Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I'm going to talk about red light therapy, something that I use personally extensively and that many of you have asked me about, and I need to talk more about it because it's a great therapy for a lot of different conditions. It's also called low-level laser, photobiomodulation. It goes by a lot of names. You're exposing your skin to an LED device with a red light that emits the correct spectrum. Red light travels deeper than, for example, blue light, which is sometimes used for acne. But otherwise, blue light's not something you want to stare at all the time. But red light is safe. It does not damage skin like ultraviolet rays from the sun or tanning beds. There are handheld devices, masks, beds, panels, and wands. I have them all. They are used for a variety of conditions, including skin improvement, acne, hair loss, arthritis, tendinopathies, pain, even dementia and cancer. And I'm going to give you a complete list of everything that it's been used for in a minute. But red light, to tell you what it is, it's a form of radiation that's visible and exists between 620 and 700 nanometers on the wavelength. Now, near-infrared therapy, which you can't see, is from 700 to 1,000 nanometers. Near-infrared penetrates deeper than red, and in my opinion, you should use a combination of both, the red and the near-infrared, because the combination really gives you the best of both worlds. And near-infrared penetrates deeper, and they both have very positive effects. So usually when I'm talking about red light, I'm talking about both of them together. In a very rare instance would I not, and I'll tell you about that in a minute. But I'm a big fan of ultraviolet light from the sun too, which has UVA and UVB, which stimulates the production of vitamin D and protects us from numerous ailments such as autoimmune disorders, various types of cancer, and cardiovascular diseases. But you got to be careful about UVB radiation. It burns, and UVA because it can damage skin. So it's good for you, but it certainly can burn your skin and cause skin cancer. So the thing about red light, it's safe. It actually protects your skin from the damage of UVA and UVB lighting. So you can definitely get too much of that. That's why I wish they would put in these tanning beds mostly red light, and maybe some B to stimulate production of vitamin D. So how does red light work? Well, we've talked about mitochondria before, those powerhouses of each cell that produce all the energy of your whole body. And that comes into play here. Red light therapy increases the ability of these mitochondrial parts of your cell to improve, repair, and overall cell function. Nearly every disease state known to man has been linked to low mitochondrial activity. Red and near-infrared light work to increase ATP production, increase cellular oxygenation, increase blood flow to the body. And remember, when you have a red light, it goes into your blood cells. It increases carbon dioxide production, which is good, and it reduces stress hormones. And I've experienced that directly when I do it at nighttime, which is every night. I also do it in the mornings. Remember, red and infrared penetrate deeply into the body, and it's safe. There's been over 50,000 plus studies published on red light therapy to date, with no adverse side effects been reported. Remember, it penetrates, but it doesn't burn. Also, note that there's many FDA-approved treatments with a red light therapy. And not that the FDA approval means as much these days as we used to think it did, because look at all the messes they've put out that they've had to retract. But in any event, it kind of makes you feel good that it is FDA approved for many reasons. Now, I'm going to give you a long list of conditions that it's been treated for. These are not all FDA approved, but several of them are. But there's a long list, and I'll read it to you. Achilles tendonitis, acne, addictions, amblyopia, which means lazy eye, macular degeneration, Alzheimer's disease, aphthous ulcers, canker sores. I've used that on myself. It works. Bell's palsy, bone fractures, burn scars, burning mouth syndrome. If you've ever seen a case of that, which I've seen too in my career, horrible. So it helps for that. Carpal tunnel, cellulite, chronic joint pain, cold sores, COPD, dental implant instabilities, depression, diabetic foot ulcers, dry mouth, dysmenorrhea, tennis elbow, fibromyalgia, glaucoma, hair loss, hand, foot, and mouth disease, hypothyroidism, lichen planus, which I also had from COVID. It really helped that. Low back pain, which I use my mat every day. Lymphedema, sinusitis, really pain of any kind. Obesity, oral mucositis, tooth pain, osteoarthritis, one of the main uses for it, osteoporosis, periodontal disease, postherpetic neuralgia that you see from shingles, pressure ulcers, radiation dermatitis, Raynaud's phenomenon, where your hands turn blue and get cold, RA, aging skin. I use a face mask for that. Strokes, sunburn for prevention, like I talked about. Testosterone deficiency, it helps that. It's not going to help it as much as a T-shot, but it's going to help it some. Toenail fungus, TBI, traumatic brain injuries. Venous leg ulcers, vitiligo. Any kind of wound healing, really, and anxiety. And finally, cancer. You have to go back to the Otto Warburg studies, theory on cancer metabolism, how cancer cells are metabolized different than normal cells. He won the Nobel Prize for this discovery, but to get into that, go look at some of his work. It's too deep for this presentation, but it's very interesting in how it really does work for that, along with other things. I call them adjunctive therapies. So now let's talk practical part of this. I do predict that nearly every household in this country will eventually have some of these red light devices in their house. I personally have them in my infrared sauna, a handheld device, a face mask, a wraparound pad, a hanging device that you stand in front of. Ideally, stand 1 foot away from the body if you're getting a whole body experience, which I prefer 1 foot. Ideally for 20 to 30 minutes. I usually do it for 20 minutes. For specific parts on your body, like an injury or for like my low back pain, sometimes my knees, I put the light directly on the site for 12 to 15 minutes. I actually do both, whole body and particular areas. And it's ideal to do first thing in the morning, think energy, and at night. It reduces stress levels, and you'll sleep better if you do that light before you go to bed, trust me. Do you need goggles? Not really, but what I do, I've got 2 settings on mine, just one for the red light and one for both. If I'm just doing it for vision, which it does improve, I just turn the red light part on, and I'll look into it. There's never been any studies that have ever shown it damages your eyes. Even with the near infrared, I just prefer to play it safe and just do the red light when I'm staring into it. But it should improve your vision. There are many brands that I love. I've tried a bunch of different types, but I'll tell you the best one that I've had is my Lumara. I've used several of these. I'll continue to use Lumara. That's my personally favorite brand, but there's a lot of them out there that you can check out. So I hope this helps. I hope you get a red light. I really do. You need these at your house because you need to use them daily. So I hope this has been helpful. Get a red light. I'll see you next week.